Hello, my name is Kristen Prelip, and I'm the Public Information Officer and Communications Manager for the Orange County Health Department. Welcome to the fifth episode of Public Health Chat. In each episode, we will meet some of the wonderful people who work in public health and will explore a variety of topics. Today, we will discuss the COVID-19 vaccination process and also talk about a contest designed to show love and appreciation to our wonderful Orange County businesses. We are joined today by Orange County Health Director Quintana Stewart, by Kirby Saunders, the Emergency Services Director for Orange County, and Victoria Hudson, the Environmental Health Division Director. Quintana, if you would start us off by giving us a COVID-19 update for Orange County, North Carolina.
Sure. So as of today, Orange County has a total of 7,218 lab confirmed COVID cases. Over the last 7 days, we've had 269 new cases, which means we're averaging about 38 new cases each day. As of today, we've also had a total of 87 COVID-related deaths here in the county. A review of our key metrics show that our COVID-like illness ED visits have decreased over the last 2 weeks. Our COVID confirmed cases have slightly decreased as of today, and our hospitalizations are stable but still higher than we like. The percent positive has also decreased, and today we're sitting at 1.7%. So it looks like things are moving in the right direction. However, there's still a lot of COVID out in our community. So we want to do better. We are aware of the UK variant strand B117 here in North Carolina. As of yesterday, there are about 20 cases throughout the state. The state lab, they have increased their surveillance testing so that they can identify any of the variant strands that are circulating at this time. Vaccination is the priority for the health department right now. So while vaccine is coming in small amounts each week, we are committed to getting it out to our community as quickly as possible. As of today, Orange County has administered 21,680 first dose shots. We've administered 9,648 second dose shots. We got some encouraging news last week. Johnson & Johnson applied for their emergency use authorization for their COVID-19 vaccine. So this is a one-dose vaccine shown to be about 72% effective in the U.S. against preventing moderate to severe COVID-19 21 days after vaccination. So as we just continue on this journey, vaccination again is our priority. It is just one tool in our toolbox to help eradicate COVID-19 in our community. So even after being vaccinated, we have to continue to practice our 3 W's. So folks will still need to wear the mask, wait 6 feet, and wash their hands often. The 3 W's also help reduce the chance of variant strands spreading and any additional mutations.
Thank you for that update. Kirby, thank you so much for joining us today. Your wonderful former boss, Dinah Jeffries, appeared on the very first episode of Public Health Chat, and I want to congratulate you on being named Emergency Services Director. Here in Orange County, we are lucky to have excellent collaboration between departments. In particular, Emergency Services and the Health Department have been close partners during the pandemic. Can you tell me how Emergency Services and Health have collaborated to open vaccination sites in Orange County?
Well, thanks, Kristen, for those warm welcome, and I appreciate the sentiment and welcome as Emergency Services Director. The Health Department and Emergency Services really enjoy a fantastic relationship and have been for well before the pandemic arose. We have really been engaged with one another more intimately for over a year now. January 25th was our 1 year marking the start of beginning COVID response, and engaged in those early days. It seems like a long time ago, was trying to gather information and prepare us to get us to where we are right now, where we're actually vaccinating to hopefully bring an end to the pandemic. So all in all, we feel like we're in unified effort and have been from the very beginning of this pandemic, which is a very fortunate position for both us and the health department, as well as our community.
So Kirby, I know that finding qualified personnel to administer the COVID-19 vaccine has been a challenge in many counties. Can you tell me how Orange County worked in advance of the arrival of the vaccines to head off this problem at the pass?
Certainly, yeah. So we have some very smart and creative individuals in both of our agencies and departments, in the health department and emergency services. We're fortunate to have very knowledgeable and energetic individuals in both departments that really are progressive in how we prepare and how we've responded to this pandemic from the beginning. Specifically about vaccinations, we were started well before we even had a COVID vaccine. Back in the fall, we recognized what was on the horizon, and our staff did, to determine that when we get vaccines, we are likely to have a challenge with having enough vaccinators to administer the vaccine. We were hopeful, and I think we are still hopeful, that there will come a day when we have far more vaccines than we have the ability to administer. That is not the case right now, of course. We have a lot of community support and a lot of personnel to administer the vaccines. Unfortunately, the vaccine still remains in limited supply, as Quintana mentioned. But specifically, how do we prepare? We began in the fall with first looking at who could administer vaccines. And so our medical director, Dr. Joey Grover, looked deeper into that issue and was able to advocate for EMTs, or emergency medical technicians, for their ability to administer vaccines. At that point in the fall, they were not, it was not in their scope of practice to administer vaccines. So it required some changes at a state level on the policy side, and we were able to achieve that. As somewhat of a trial run and to get us prepared for the COVID vaccine, we started working closely with our health department partners to administer the flu vaccine, and to become responders in getting flu vaccinations out in the fall. And that put us in a really good position to have qualified, competent, and prepared EMT basics to administer the COVID vaccine. To date, our EMTs is not just emergency services EMTs, but it is EMTs within our volunteer fire departments and throughout the community, have been really instrumental in the effort thus far to administer vaccines to the Orange County community. And that is something that we take great pride in, and it's no easy feat to have changed policy guidance at the state level to even at a local level incorporating EMTs who are volunteers within our community. And so in some ways it's like the community vaccinating itself, which is very an awesome sight to see. And so we would not be where we are today without those efforts. And I think about 45% of staff administering vaccines have been EMTs or paramedics thus far. So a very large number of vaccines that have been administered in our community have been administered by EMTs and paramedics from across the emergency services system, not just Orange County Emergency Services, but again, the Volunteer Fire Department, South Orange Rescue Squad, and emergency services all collaborating together, which is really exactly how we responded this whole last year as one community. You know, COVID has impacted the whole community. It has taken the whole community to respond, and it is still taking the whole community to close out and bring this pandemic to an end. So.
Wonderful, thank you. So Quintana, what has been your experience working with emergency services to get shots in the arms of Orange County community members?
Well, Kristen, I would say our partnership with emergency services has been wonderful, even before the start of the pandemic. The transition with directors has been seamless, and we just couldn't do this without their help. I mean, frankly, whenever we show up and we're on site at a pod for the vaccinations, we will be dead in the water without our partnership with EM. So I would say, in addition to them helping to put the shots in the actual arms, they are really our backbone with the pod setup and logistics, and helping us with staffing. And I mean, hey, Kirby even, laid down and helped design our pod flow in the traffic plan. And so it has been a wonderful partnership, and I am just very happy and excited to have Kirby named as our emergency services director. And we joke, I feel like I start the day with Kirby and I end the day with Kirby. But it's just our constant open lines of communication, and it's appreciated. And again, I don't know where we would be without their partnership.
All right, thank you so much. So now we will turn to speak with Victoria Hudson. Victoria, you were on our second public health chat, but would you remind us what your title is and what kind of work you do at the Orange County Health Department?
Awesome, thanks. So I am Victoria Hudson, and I serve as the Director of Environmental Health with the Orange County Health Department. The services that environmental health provides, most people know that as like the health inspectors, and we have a large part of our department that provides on-site water protection services, and the other part of our department provides the services for retail food protection, institutions, and lodging inspections of inspected establishments that also provide some courtesy inspections as required by state licenses.
You and your team work very closely with Orange County businesses, and you see firsthand that this pandemic has been particularly challenging for them. Can you tell me about this contest that runs through the end of February?
So one thing for sure that we can say is constant about this COVID response and recovery period is that change is constant. And one of the main ways that the governor's office in North Carolina DHHS chose to do some control and limits had to do with like occupancy and businesses and what could be open and what was a threat to the community as far as community transmission. And we did a lot of regulating, and we did a lot of recommending and requiring. And over the past several months, what we've seen are good businesses that have gone above and beyond to really try to protect consumers and their employees. I mean, they've made all sorts of sacrifices, and they continue to change with the things that we can recommend and require, what the governor's office wants from them. So the method of recognition is often very negative from our office, and I am tired of some of that negativity, and I want a place, an outlet for the public to nominate and to vote for businesses that are really doing an outstanding job. And so this challenge that goes through the end of February is to ask for the public to submit nominations that count as a vote each, and to nominate the businesses. If they might be an employee and they feel like that their boss and their company and their corporation is doing an outstanding job of protecting them as an employee, well, there is a category for best COVID safe employer. And then the second category are for consumers to vote when they feel like a place of business where they've conducted, and it could be any kind of business. It could be a post office, it could be a hairdresser, it could be a retailer, it could be a gym. But those places that really have followed the executive order and may do even more to protect those consumers. And then the final category, we're just calling most valuable player. And those are places, I think, and reading some of the nominations so far, those are places that have either been exemplary from start to finish or have really turned something around for them. You know, like they really recognize the change and a way of compliance. And so I think that those votes are going to be super important. So the winners of each category will be the recipient of a prize. And for the COVID safe employer, the best COVID safe business for customers, and the most valuable player will each receive a professionally photographed and graphic designed that will show up on the side of a Chapel Hill Transit bus for 3 months. And this is the size that they call King Kong size. It's the side of the bus. And hopefully that the graphic is going to really indicate that this was somebody who was like #1 in COVID safety. And we really feel like that that's a valuable prize. It has a street value of about $1,000. And it says a lot about what that place, what that business was able to provide as far as COVID safety. So make sure you vote by February 28th.
I also understand that they will receive a very handsome trophy.
Yes, both the first place and the second place for each category do receive an awesome trophy.
Wonderful. Okay, so just the last thing, I know that we have received, as of Monday, 530 contest entries, and you can vote all the way through February 28th. Just go to orangecountync.gov/environmental health to vote. We're also posting on our social media often, so you can get the link from there. But if you don't mind, if you just give me a couple examples of entries that really stood out to you, that'd be great.
Sure. This one is a recommendation, a vote, a nomination for best business for employees. This says, the owners of Technica Editorial Services have been most considerate and communicative to all of their employees, allowing them to work from home if they choose to do so, and keeping the environment safe, sanitized, and prepared for those who might need to go to the office. They have remained extremely supportive and flexible with all the staff. Technica is a fantastic company to work for.
Awesome.
And then the one that I really saw today that I was like, yeah, a most valuable player, Vimela's Curry Blossom Cafe. Vimela's has done a fantastic job keeping safe the customers and the employees, and has given back to the community during this difficult time. I have the best experience with their curbside pickup out of any restaurant in the Chapel Hill Carborough area.
That's great. I love to hear that. All right, well, I have one last very important public health question for you all. This Sunday is Valentine's Day. For those of us who have been responding to the pandemic for over a year, we hopefully have people in our lives who support us at home so we can do this challenging work. I want to honor those supportive partners, so please tell me who you will be celebrating Valentine's Day with, and I'll go first. My husband, Pat Mallett, has cooked a lot of meals and done a lot of cooking and cleaning and taking care of children and whatever it takes, because I'm in front of the computer all the time. So I just want to say a shout out to Pat Mallett. I don't have anything planned for Sunday, but I hope we can do something fun. Okay, Victoria, I'm going to pick on you.
Oh, wow. So probably the thing that I could probably say that I support the most, it's been supporting me, is my cell phone. And it gets me food when I need it, and supplies and things get delivered to my house. And I couldn't have done it without my cell phone.
Excellent. Thank you. I love your cell phone. Quintana, how about you?
Oh dear. Well, thanks for the reminder that Sunday is Valentine's Day. Days are all a blurry nowadays. So I will be spending Valentine's Day with William and Noah, my husband and my son. And I think the one thing I could do, because they have been extremely patient, so my goal is to cook them a home cooked meal this Sunday, because we have done lots of takeout over the last year. So I will attempt to cook a nice home cooked meal this Sunday.
Beautiful. And how about you, Kirby?
Yeah, that's a great question. I think I want to honor and celebrate my mother. She's really been my whole life been my rock star, and she's been a rock star for me and to lean on. And it's been challenging for her at her age as well, being at high risk. And so she is getting her vaccine. She lives in Virginia, but she's getting her vaccine Saturday. So we're going to celebrate her vaccine remotely. And I really want to send a special thank you to her for all of her support. So.
Beautiful. Well, I want to thank each of you all for your hard work during this pandemic, for your leadership, and for participating in this public health chat today. Stay safe and healthy, everyone. Goodbye.
Bye.